What I would tell you is buy as much ultrasound as you can afford. What if your PRP injections are missing the mark and you don't even know it? 20% of the time, you're not getting lucky and you don't know where you are, and you're putting an injectate somewhere where you don't know where it is and the patient doesn't know where it is, and maybe it's harmful and maybe it's helpful. Are you still injecting blind? What if your PRP injections are missing the mark and you don't even know it? Is ultrasound-guided PRP just hype or a must-have? We'll tackle that question head-on. I'm Dr. Ariana Demers, the Queen of Orthobiologics, and I am leading the way in orthopedic surgery innovation, shaping medical practices for success. Let's talk about whether ultrasound guidance for PRP improves accuracy or outcomes, and when it's truly necessary. You'll hear the latest evidence and real-world practice tips. By the end, you'll know when to use ultrasound and when you might be able to skip it. So the question is, should PRP be ultrasound guided? Ultrasound can pinpoint small or deep targets like partial tendon tears, intra-articular joint space, the subacromial bursa, intra-articular hip, and this helps avoid critical structures such as nerves, blood vessels, cartilage, and other important structures. And it dramatically boosts injection accuracy. For example, a blind shoulder injection is only about 70 to 80% accurate, whereas ultrasound-guided injections exceed 95% accuracy. It's like having X-ray vision on the end of your needle. Real-time visualization of the soft tissues means you're not guessing. You know exactly where your PRP is going every single time. The results aren't just greater precision, but also greater patient trust in the procedure itself. So people ask, does ultrasound-guided injections improve PRP outcomes? Absolutely. The broader clinical benefit of ultrasound guidance is undeniable. It allows clinicians to deliver PRP directly into the precise site of pathology, which is especially important in small tears, interlaminar tears, deep structures, or complex anatomy. This precision minimizes risks like missing the target, injecting too superficially, or causing unnecessary discomfort. It also makes procedures more reproducible. Ultrasound optimizes every part of the process, and in regenerative medicine, accuracy matters. So which cases benefit most from ultrasound?
Don't miss out. Please subscribe to our newsletter now to stay ahead of the world of orthobiologics. You can find the link below. Additionally,
if you're ready to start this journey with me in my Orthobiologics Masterclass, come join us. Now, a lot of people tell me that the large joints, like the knee, that are superficial are relatively easy to hit blind, with accuracy rates around 80 to 90%. So some experienced practitioners skip the imaging there. But with smaller joints, complex spaces, or soft tissue targets like shoulder compartments, the wrist, plantar fascia, tendon insertions, blind accuracy can fall to just 50 to 60%. In these cases, ultrasound guidance dramatically improves precision. It becomes especially valuable when treating subtle pathology, altered anatomy from either injury or surgery, or when you're early in your PRP learning curve. So let's think critically about that. If the structure is small, deep, or difficult to palpate, guidance is critical for not missing the target altogether. Now, there are costs. Ultrasound equipment is not cheap, and proper training takes time. Procedures may also take slightly longer with imaging. But for many physicians, ultrasound has become routine. It's a valuable tool, not just for accuracy, but also for confidence, safety, and documentation. Additionally, when precision matters, it is well worth the investment and peace of mind to know you are delivering the injectate exactly to the target. So ultrasound guidance greatly improves injection accuracy and safety, especially in small or complex areas. In other words, ultrasound is a powerful tool. It's not magic, and I would definitely recommend using it. Sometimes I tell people that it feels like my third arm, and I can't imagine doing my job without it. I feel like I am literally going blind when I don't use ultrasound. And honestly, I think the key is choosing the safest, most precise approach for every patient. So which cases benefit most from ultrasound? A lot of docs tell me that they know where the knee is and they think they can hit it with a pretty high accuracy. Now, I would tell you that the accuracy is only 80 to 90% with a blind injection. While some experienced doctors skip the imaging, I think that's a misstep. Even if you do know or you get lucky 80% of the time, 20% of the time, you're not getting lucky and you don't know where you are and you're putting an injectate somewhere where you don't know where it is and the patient doesn't know where it is. And maybe it's harmful and maybe it's helpful. But with smaller joints, more complex spaces, or soft tissue targets like the wrist, the plantar fascia, tendon insertions, blind accuracy is around 50%. In these cases, ultrasound guidance dramatically improves precision, and it becomes especially valuable when you're treating subtle pathology, altered anatomy, either from surgery or injury, and it allows you to be better every time. So think critically. If you can do a better job, if you know where you're going, then you should use ultrasound. And for me, that's every time, every patient, to avoid undue pain, to avoid not knowing where you are, placing the injectate in the wrong spot, or being confused as to what anatomy is what. Because when I look under ultrasound, I know people are very variable. And so it pays to know exactly where you are at all times. Now, a lot of my docs that I talk to say, well, yeah, that's all good and fine, but and then last time I checked, an ultrasound wasn't too cheap. Like, can I just go get a handheld ultrasound? Or, what's the minimum amount of money that I can actually spend to do a good job? And what I would tell you is buy as much ultrasound as you can afford. That does a couple of things. It gives you a really good product, meaning you can really see. And if you're just starting out, it's going to cut down on the amount of frustration that you have using a lower quality ultrasound. And there are other ways to get really good quality ultrasounds. You can use one from your ultrasound department, your imaging department, borrow it, check it out. You can get a refurbished ultrasound or an older model ultrasound. Now, it might not have all the bells and whistles or the latest greatest, but it is going to be a much better picture than the lower quality ultrasounds. And really, I always tell my colleagues that are just starting out, what you don't want is polar bear in a snowstorm or black bear at night, where you can't see anything, you can't delineate anything. So for the money, buy as much ultrasound as you can possibly afford. And then the third part is this does not happen overnight, and it does take time. Now, you're going to have some quick wins. You're going to be able to identify the joint right away. The more subtle techniques take time, take training. For me, I've been doing ultrasound since 2010, and I'm still learning new techniques and new tips and new ways to use the ultrasound to enhance how I take care of my patients and how precise I can place my needle and my injectate. So if it's precision that you're looking for, and with orthobiologics and regenerative medicine, it is, then using ultrasound is a critical investment that you cannot skimp on, and I wouldn't skimp on the training either. I think it's really important. Now, if you found this discussion helpful, please subscribe to my newsletter for more on PRP guidance and practice building advice.